Hello, I'm Dr. Rohini. Today I'm going to talk about early pregnancy scan. So, early pregnancy scan is done in the first 3 months of pregnancy, and it's the first scan which is done after the pregnancy test comes as positive. So, what are the things that we look for in an early pregnancy scan? The first thing that we check is whether the pregnancy is inside the uterus or not. If it is outside the uterus, usually it's called ectopic pregnancy. The second thing that we look for is whether the pregnancy is going to be a viable pregnancy or not. So once after confirming that the pregnancy is within the uterus, what are the next things that we see in the scan? So next we would see a circular structure, which is the earliest sign of pregnancy, which is called a gestational sac or G-sac. Now whether inside the gestational sac there will be another circular structure which we call as the yolk sac. And then there will be presence of a fetal pole, and after this slowly the baby grows bigger and the fetal pole grows bigger, and it is measured as crown rim length, that is CRL. And once the CRL is appropriate, there will be appearance of fetal heart rate. So all these criteria are looked into when we do a scan. So now what are the signs of a viable pregnancy? So for a viable pregnancy, there should be appearance of fetal pole when the gestational sac is less than 25 millimeter, and there should be presence of fetal heart rate when the crown rump length is less than 7 millimeter. So in case if we sometimes have a doubt, or if there in those cases, what we do is we call the patient for a repeat scan after a week to see if there is appearance of fetal pole or appearance of heart rate. So now these are some of the things to see if the baby is viable or if the pregnancy going on well. Now the third thing that we look into for the first was confirmation of pregnancy, the second is all these parameters, the third is there is any presence of any hemorrhage, or if there is any presence of any other fibroid within the uterus. All these things we would be looking around the sac. And the fourth thing is we look into something called choriodecidual reaction, which is the area surrounding the gestational sac. If that area is healthy, that means that is also a sign of a healthy pregnancy. Now, after all these things, we also have a look at the ovaries, that is the adnexa, ovaries and fallopian tubes in the scan. Now, why are we looking into it? Like I told you, sometimes there is a condition called as ectopic pregnancy. In this condition, the pregnancy can be present outside the uterus, and there's also a condition called as heterotopic pregnancy. In this, there may be pregnancy inside the uterus as well as outside the uterus. Commonly occurring areas are fallopian tubes and ovaries. So in the end, we also have to see whether the adnexa, that is the ovaries and fallopian tubes, are healthy or not. So all these things are looked into while we do an early pregnancy scan.